My name is Rishikesh Kulkarni. I am a statistician at Cytel and head the customer experience group here. Welcome to our on-demand webinar on test for multiple endpoints with gatekeeping procedures and test for non-parametric combination. This is the second in a three-part on-demand webinar series featuring new elements from our latest releases of StatExact and LogExact. The first one in this series was on unconditional test for stratified two binomials. You can listen to that webinar by visiting www.cytel.com. StatExact and LogExact are the leading toolkits for exact inference, power analysis, and regression analysis. I'm delighted to introduce you my colleague Ashwini Joshi, our webinar presenter today. Ashwini is a subject matter expert in mathematics at Cytel. She received an MSc from IIT Bombay, and prior to joining the industry, she was an assistant professor in mathematics at PVG College of Engineering and Technology. In this webinar, Ashwini will describe how StatExact provides an exact method to analyze multiple endpoint data rising from two binomial or two categorical samples. We will conclude with a discussion of some frequently asked questions. I will now hand over to Ashwini.
Thank you, Rishikesh. Hello, everyone. Today I'm going to talk about tests for multiple endpoints. Outline of this presentation is multiple endpoints. So first we'll get familiar with multiple endpoints, then the concept of gatekeeping and combined inference. Then we'll see exact test for multiple endpoints and exact non-parametric combination test. And we'll also see some examples. So generally in clinical trials, we are interested in more than one endpoint. When there are multiple endpoints, like say we are talking about headache, dizziness, pain, different endpoints, not all the endpoints are of the same importance or same weightage is not given while analyzing the data. So the primary endpoints which are of interest, we call it as the first family or family of primary endpoints. Then you can have secondary endpoints and tertiary endpoints like that. So when there are multiple endpoints, generally they are divided into families of endpoints. When there are families of endpoints and we want to analyze the data, then the family-wise error rate one has to look for. So the type 1 error that is available will be used by the whole family, rather all the endpoints. So the gatekeeping is required. That is, the primary endpoint will first use the type 1 error, and the remaining type 1 error will go to the secondary endpoints and so on. There are two gatekeeping procedures that are popular, serial and parallel. As the name suggests, serial gatekeeping is sequentially we do one by one. And in parallel gatekeeping, we divide the type 1 error across the endpoints and parallelly we check at least one of the endpoints is significant or not. There are many asymptotic methods available for gatekeeping. Many of them are also used for multiple comparison procedures, but in this presentation, I will be talking about exact methods of inference for multiple endpoints. First, we'll see the simplest, that is serial gatekeeping. In serial gatekeeping, the idea is there are, suppose, m endpoints in the first family. That means there are m primary endpoints. To analyze the data for these m endpoints, suppose there are test statistics T1, T2, Tm, depending on what effect size and what kind of testing you want to do. So these test statistics are there, T1, T2, T3 up to Tm. In computation, in exact in asymptotic computations, it is easier to find the probabilities and p-values for each test statistic. While for exact computation, if we want to keep the underlying correlation structure of these endpoints intact, we should first prepare a joint distribution of all the endpoints and then compute the marginal p-values from the marginal distribution of each endpoint. So if such marginal p-values are available, so these marginal exact p-values are shown here by p1, p2, pm for m endpoints. In serial gatekeeping, we are saying that each endpoint should be proved to be significant, only then we'll go to the next endpoint. And once all the endpoints of one family are considered, then we'll go to the next family. That means if any one of these p-values is not significant, that is greater than alpha, then we cannot go ahead. So we are not worried about each individual p-value. We are saying the max possible p-value also should be significant. Then only the serial gatekeeping will allow the analysis to go to the next level. So the adjustment that is required is taking the maximum over all the p-values. So the adjusted p-value is max of all of them. And the serial gatekeeper will pass to the next level only if this adjusted p-value is significant, that is less than alpha. For doing this computation, we use the joint distribution. So here you can see if there are 4 endpoints, endpoint 1, 2, 3, and 4, all possible combinations are already listed here, and the corresponding count is given, how many times that combination has occurred, and the probability of observing that particular combination of endpoints. So from such joint distribution, marginal distributions are generated, and from there, marginal exact p-values are computed. That was for the serial gatekeeping. If there is parallel gatekeeping, there we are saying not all endpoints should be significant. Suppose again there are m endpoints in the first family, so there are m primary endpoints, their corresponding test statistic and exact marginal p-values. All the procedure remains same up to here. Next is we are saying at least one endpoint should be significant. So we are not saying all of them should be significant. At least one endpoint should be significant. That means one of these p-values, you can say minimum of them should be significant. That is okay. So minimum of the p-values means the maximum of the test statistic. So instead of considering each test statistic, we'll compute max of each combination of test statistics. So max of combination of test statistic, and we'll see the cutoff value where we get probability equal to alpha. So we'll compute the cutoff C by considering the probability of observing max Ti greater than C equal to alpha. Now, out of these m endpoints, some endpoints are say significant and suppose some are not significant. So the endpoints which are not significant, the null hypothesis will be accepted, and if A is the set of such hypotheses which are accepted, that means the p-value was not significant. They have utilized some type 1 error. So that type 1 error is computed by finding the probability of those test statistics, finding the probability of those hypotheses which are accepted and take the maximum over them. Those which are greater than the cutoff value will consider this probability as the type 1 error used by the first gatekeeper family. So out of given alpha, some alpha is used in this parallel gatekeeper. Some alpha is used by this parallel gatekeeper family, And the remaining type 1 error will be passed over to the next family, that is the total alpha minus the utilized alpha. And the same procedure will be repeated for the next family. So we'll again start with the number of endpoints in second family. We'll compute the cutoff. We'll see which hypotheses are rejected, which are accepted or could not be rejected. We'll compute the type 1 error used by that family, and the procedure will continue. Let's see how we can perform this exact computation in StatExact using an example. Here I have considered an example, call it as migraine data. Here the treatments are, one is placebo and telkejepant is the treatment of interest. Here number of patients are 100. There are total 4 endpoints, out of which 3 are primary endpoints. So in migraine, the problem could be pain or phonophobia or photophobia. So the primary endpoints are pain freedom or pain relief or absence of phonophobia, so tolerance to the noise level, then absence of photophobia, that is tolerance to light. And the secondary endpoint is sustained pain relief. So the first or primary endpoints are measured after 2 hours after the treatment is administered, and the secondary endpoint is for the sustained pain relief. So it is also important, but first we need to look for the primary endpoints. Let us see how we can do that using StatExact. So here I have the saved data of migraine. I'll open that. Here are the subject IDs. There are 100 patients. Here's the treatment ID. It is 01. And pain freedom, absence of phonophobia, absence of photophobia are the primary endpoints, and sustained pain relief is the secondary endpoint. In Nonparametrics menu, you can see for continuous data, 2 independent samples. You have here multiple endpoints with gatekeeping, but this is for continuous data or categorical data. So when endpoints are continuous or categorical, we can use this test. But in this particular example, all the endpoints are binary. So I'm coming to 2 independent binomials and multiple endpoints with gatekeeping. These 4 are the endpoints. I'll select them in endpoints box, and the treatment ID, that is there is no frequency. We can choose parallel or serial gatekeeping. We can specify the alpha. So this is the total alpha for all the families, and then as we have seen, the type 1 error will be computed for each family separately. Here are the endpoints. You can specify in which family they are. So the first 3 are in primary family or the first family, while SPF is in second family. So I'll change that. Here we can choose the test which we want to perform on that endpoint data. It could be difference of proportion, ratio of proportion, or odds ratio of proportion. For the time being, I'll keep all of them same, that is difference of proportion, but you can choose any one of them. You can also choose the rejection region as right tail or left tail, depending on the data you have. Again, for the time being, I'll keep them all fixed, that is common rejection region. The data is not that large, so we can perform exact. If data is mid or large size and exact computation is taking a lot of time, or if you don't have enough memory on your computer, you can also try using Monte Carlo method. So it is again exact but with sampling. And in options tab, you can specify the response value for each endpoint. If you are using if you are using Monte Carlo method, you can specify the Monte Carlo method related options. What is the seed? How many times you want to see the intermediate display? What is the random number generator you want? And so on. In the General tab, you can specify the confidence level. You can specify the time and memory limits. You can also save the exact distribution. So if you save the exact distribution, you will see the joint distribution of all the 4 endpoints as we have seen in the presentation. Right now, I'm not doing that as it may take more time. Let's see if we run exact. It came quite fast. Here you can see the batch is also generated. So if you want to rerun it, you can just copy the batch and paste it here, the command prompt, and execute it again. Or if you want to change something here, you can always do that. So instead of serial here, you can write parallel and you can run the parallel gatekeeping. Here are the all inputs that we have specified. Here is the summary for each endpoint when executed individually, or you can say marginal part of it. Then starts the inference for multiple endpoints. For the first family, 3 endpoints are there. The test that is executed and the test statistic is shown. The raw exact p-value, that is the marginal exact p-value, is shown. The adjusted p-value is shown. For serial gatekeeping, we have seen the adjusted is nothing but max of all 3. So here it is 0.076 and it is more than 0.25, the input alpha. So the status is unable to reject for all 3 of them. So family 1 is not passed with serial gatekeeping. We have said if any one of the endpoint is not passed, we cannot pass to the next family. So here it is not passed. So for the second family, it says not tested because it has not come to the second family. So I have already executed this and I'll show you the outputs here. Same thing, serial gatekeeping we just now saw. For parallel gatekeeping, again the summary of endpoint will be same. Here you can see the raw p-value is also same as we have seen in serial gatekeeping, but the adjustment is different. We have seen the adjustment by taking the maximum of test statistic and using the cutoff. So here you can see the adjusted p-value for the first endpoint, phono or absence of phonophobia, is significant. So that particular endpoint, we can say hypothesis is rejected, while for the remaining 2, it is unable to reject. The status says unable to reject. But in parallel gatekeeping, we say even if one of them is rejected, so at least one endpoint is showing significant difference, then we'll go to the next family. So here it says family 1 is passed with parallel gatekeeping, and in family 2, only one endpoint, SPF, is considered, and the adjusted p-value is showing significance, so the status is rejected. So we can say that family 2 is also passed with parallel gatekeeping. So the treatment is significantly different than the placebo or better than the placebo. So in multiple endpoints test, we have seen the exact method of parallel gatekeeping and serial gatekeeping. Now we'll see the next test as non-parametric combination test. For the single family, so suppose there are multiple endpoints, but all of them are of same importance. So it is only one family with all primary endpoints. So there is no gatekeeping required. But for each endpoint, we'll get separate inference. While finally, we want to say if treatment A is better than treatment B or not. In that case, we need the combined inference. So we cannot say for endpoint 1, yes, for headache, it's working better. For dizziness, it's not working better. So we cannot say that. We want some combined inference. So how to get this combined inference? When we have different endpoints and different effect sizes, different test statistics. Finally, we want some global null hypothesis. So if this global null hypothesis is rejected, we'll say, yes, treatment is better than control. So this global null hypothesis will be actually intersection of each individual null hypothesis for each endpoint. So that's the idea behind non-parametric combination test. How do we perform this non-parametric combination test? Again, we start with the joint distribution because we have said that we want that underlying correlation structure intact. Then we'll compute the raw p-value from the marginal distribution, same as we have done for multifamily case. Then we want the whole distribution. We are not interested in only p-value of the observed data. So we'll compute the p-value for each test statistic. Further to that, if the test statistic is of different kind in each endpoint, then it is difficult to combine the test statistics, the distribution of test statistics. But if we transform everything into p-values, it would be better. So that was the idea of the authors who started writing about this non-parametric combination test. So we have implemented that idea of replacing the test statistic with its corresponding p-value. So now we have the p-values as the test statistic. StatExact has also provided something similar for single 2x2 data when we implemented Boschlu's test, where p-value of Fisher exact test is considered as test statistic. So here something similar we are doing. Instead of test statistic, we are using the p-value. And then for each endpoint, we have the p-values and we'll have the combined p-value as the combined effect or combined test statistic. And then we'll use the distribution of this combined test statistic with the point probability computed in exact distribution. Let's see how we are doing it in using StatExact. We'll consider an example. Here the study is about neurotoxicity study of PERC. It is perchloroethylene. It is a chemical that is most commonly known for its use in the dry cleaning industry and textile manufacturing or metal cleaning operations. Two concerns were expressed about this chemical. One was related to the possibility that it can have various non-cancer effects such as headache, nausea, dizziness, etc. These effects are said to occur almost exclusively in workers who were working in that industry where the dry cleaning or metal coating is done. The other was related to the possibility of long-term exposure to this chemical, and it may cause cancer both in workers and in the general population who are exposed to the air around the industry, So a study was conducted on laboratory animals. And here the treatment is exposure to the chemical. Here the outcomes are central nervous system excitability battery. So various aspects are considered in this. It is the handling reactivity. So after treatment is administered, how the animals are, while handling, how the animals are behaving. So mainly the behavioral aspects are seen. What is the difference in the movement of animals and the arousal, that is the response to touch, heat, in general, the senses of animals. So these are the three outcomes and all three are important. So all three are primary outcomes. The study was conducted with 5 dose levels. 0 is the placebo, no dose was administered. And then there are 4 more levels of the dose. 8 animals were treated in each dose group and 3 outcomes are considered. So out of 8, you can see here 4 events are observed with no treatment or dose level 0, 3 4.15, and so on. So 4 hours after exposure, each animal was classified for presence or absence of adverse events, and the data is displayed here. For this particular demo, I have considered only 2 levels, that is the lowest 0 level and the highest, that is level 5. Let's see how StatExact will help us in getting the combined or overall effect. So let's go back to StatExact. And again, I have saved the data. Here is the animal ID, the 3 outcomes, and the dose levels. As I said, I have considered only 2 dose levels here. Now we'll execute the non-parametric combination test. As I said, for if the outcomes are categorical or continuous, you can use this 2 independent samples menu, and here is the non-parametric combination test, the multivariate test, and it is developed by the duo Pesarin and Salmaso from University of Padua, and we have used their theory while implementing this test. So the name is given here. In this case, we have all the outcomes as binary, so I am again going back to 2 independent binomials and Pesarin-Salmaso NPC test. The 3 outcomes are added in endpoints. Sorry. 3 outcomes are added in endpoints, and dose is the treatment ID. Again, common rejection region you can keep, or you can change the rejection region here. You can decide which test you want to implement, because finally we are converting all test statistics into p-value. And finally, we'll have to combine the p-values that we have seen to get the overall effect. So 3 methods are given for p-value combination: inverse normal, Fisher, and min p. Again, you can perform exact or exact using Monte Carlo method, and let us click OK. And here is the output. Again, the batch command is generated, inputs are shown, summary of each endpoint is given, and the inference for non-parametric comparison test is given. So raw p-value, the adjustment we have already seen. This is the way we have done for parallel gatekeeping, but it will not be used in this particular case, but we have shown the adjusted p-value as well. While this is the overall p-value, which will tell us if the overall effect is significant or not significant. So here is the overall p-value when the combination function min p is used, that is shown here. So I have already executed it with all the 3 methods, so I'll take you to the presentation again. So the raw p-value and adjusted p-value will be same for 3 endpoints in all the 3 p-value combination methods, but the overall p-value will be different. You can see min p is significant but quite high, 0.04, while Fisher and inverse normal are really small, 0.003 or 0.002. We'll see the graphical representation that will give us better idea how these non-parametric combinations work. So the first graph shows a relationship for probability and the p-value. In this case, p-value is nothing but our test statistic. So test statistic for the endpoint arousal. The next one is for handling, and the third is for movement. It is a discrete data, so you won't see the nice continuous curve. So we have actually seen the bar here. So only 5 values are observed for arousal. If we combine these 3 distributions into one using min p, the distribution will look like this. And the observed value is somewhere here, so you can see the p-value is really small. When we use inverse normal, combining these three distributions gives us the combined distribution like this. You see where the observed lies and you can compute the p-value. Similarly, when Fisher method is used for combining the three distributions, the combined distribution looks like this. So this will only give you the idea how each method is giving us a different combined distribution. So clinicians have to use their experience while deciding which method to use for combining the results. Here are the references for multiple endpoints and non-parametric combination test. The multiple endpoints reference which I have given here is actually for asymptotic method, and in-house statisticians of Cytel have actually developed the exact method. Right now I don't have the published reference from them, but you will soon see that also. And here are the references for NPC test, that is non-parametric combination test. So thank you. And if you want more information, please contact us on email at support@cytel.com. Now we'll have discussion on some frequently asked questions. So over to you, Rishikesh.
Thank you very much, Ashwini, for a very informative session. We are now going to discuss some commonly asked questions on this topic. We have 3 questions. The first one is, in the software, can you actually show us how to access the joint distribution used for the underlying computation?
Sure. Let me go back here. I'll execute the same thing again, which we just now saw. Pesarin-Salmaso test. And when I've considered exact, in Options tab, go to the General tab, and here you will see Save Exact Distribution. So if you select it, you can specify the file name where you want to save it. So in my case, let us save it on D drive. I'm saving in PC for this demo. And execute it. Yeah. So you'll again see the output and the distribution. It's saved here. For non-parametric combination, along with this joint distribution, so joint distribution actually ends here. The test statistic of 3 endpoints and the corresponding probability. But for non-parametric combination, we said that we'll be replacing the test statistic by p-value. So the p-value stands for the new test statistic. So we have also shown these new test statistics or p-values instead of original. And this is the combined p-value, which is our overall test statistic. So here you see it. You can save it as CSV or PRN file and then use it wherever you want.
Great, thank you. The next question is, what are the different test statistics options available for continuous and binary variables? I believe this one is also for multiple endpoints.
Yeah, so for both, the same type of test statistics are currently available. So even in multiple endpoints, when we say that this is an endpoint, you can select difference of proportion or ratio of proportion or odds ratio of proportion. And if you are interested in continuous or categorical data, then you can have permutation test. So permutation test statistic or Cochrane-Armitage test statistic. So these are the 2 options available.
Okay, okay. While you're on that window, I have one more question, which is again commonly asked is, does this version and the feature implemented in this version allow us to use or specify mixed endpoints? Like a few of the primary endpoints are continuous and a few of them are discrete. Is that mixture available?
Unfortunately, right now it is not available. We are planning to do it in future version. But one way out could be you can consider all of them as continuous or categorical, but you will not able to use then difference of proportion. Even for binary, you will have to use one of these tests.
Okay. Okay.
That
So
could
it
be
will
one
implemented.
option, but yeah, it will be implemented later.
Okay. Okay. Thank you very much, Ashwini, again. And thank you again, everyone, for listening to our on-demand webinar. Don't forget to check out our other webinars in this series, the two on unconditional test for stratified two binomials, and the other one on saddle point approximation, by visiting www.cytel.com. And to learn more about StatExact and LogExact, visit our website www.cytel.com /software. Thank you.